Bismillahirrahmanirrahim. Welcome to today's lecture on the layers of the scalp. The scalp consists of 5 layers, the first 3 of which are intimately bound together and move as a unit. So the 5 layers of the scalp are: number 1, the skin; number 2, connective tissue; number 3, the aponeurosis; number 4, loose connective tissue or loose areolar tissue; and finally, number 5, the pericranium. So, first of all, we'll discuss the skin. The skin, which is the first layer of the scalp, is thick and hair-bearing and contains numerous sebaceous glands. So the skin, the first layer, is thick, contains hair follicles, and also contains sebaceous glands. The second layer. Now we move to the second layer, which is the connective tissue. The connective tissue is beneath the skin. It is a fibrofatty, and the fibrous septa uniting the skin to the underlying aponeurosis of the occipitofrontalis muscle. Numerous arteries and veins are found in this layer. The arteries are branches of the external and internal carotid arteries, and a free anastomosis takes place between them. So, the connective tissue is fibrofatty. It contains arteries and veins. And of course, as discussed, there are branches of the internal and external carotid arteries. Now, the third layer of the scalp, is the aponeurosis. The aponeurosis is a thin tendinous sheath that unites the occipital and frontal bellies of the occipitofrontalis muscle. So it's basically thin tendinous sheath. The lateral margins of the aponeurosis are attached to the temporal fascia. The subaponeurotic space is the potential space beneath the epicranial aponeurosis. It is limited in front and behind by the origins of the occipitofrontalis muscle, and it extends laterally as far as the attachment of the aponeurosis to the temporal fascia. Now, the fourth layer is the loose areolar tissue, which occupies the subaponeurotic space, and it loosely connects the epicranial aponeurosis to the periosteum of the skull, the pericranium. The areolar tissue contains a few small arteries, but it also contains some important emissary veins. So the loose areolar tissue contains a few small arteries. And it also contains some important emissary veins. Emissary veins are valveless and connect the superficial veins of the scalp with the diploic veins of the skull bones and with the intracranial venous sinuses. Now moving to the fifth and the final layer of the scalp, which is the pericranium. The pericranium is the periosteum covering the outer surface of the skull bones. It is important to remember that at the sutures between the individual skull bones, the periosteum on the outer surface of the bone becomes continuous with the periosteum on the inner surface of the skull bones. So, the pericranium is the periosteum covering the outer surface of the skull bones. Alright, so we have discussed in detail the 5 layers of the scalp. We just take a look at the diagram one last time. So in the diagram, this green is the skin, And then this red shows the connective tissue. The yellow shows the yellow shows the aponeurosis. The purple shows the loose connective tissue or the loose areolar tissue. And finally, the black shows the pericranium. This brings us to the end of the lecture on the layers of the skull. Thank you.